Dr. Currie here. Did you know that I work with a lot of patients who have what's called shopping cart syndrome? Okay, so what that means is that whenever someone has a compressed disc and then those joints jam up back here and then it pinches and chokes the nerves, then someone will lean forward. They'll get that shopping cart and they'll lean forward. Now you can see on this model here, when you lean forward like that, that can take some of that pressure off of those nerves. So oftentimes I'll meet with couples, and usually what will happen is that the wife is saying, Dr. Currie, I tell him he should just stand up straight, and he just won't do it. He just won't stand up. I tell him all the time, Dr. Currie, he needs to have better posture. He should stand up straight. But all he does is he just keeps leaning forward. And I explain, ma'am, look, I'm not trying to make you mad because it usually doesn't go well if you make the wife mad. But he can't stand up straight. It's a subconscious thing. So what happens is that the brain says, hey, you know what? If you stand up straight, or if you don't go find a place to sit down, then it's going to load up those joints and pinch the nerves. So the brain will say, hey, you know what? Lean forward. And people don't mean to. But then the greater problem that can come along with that is that the more people lean forward and give into that, then they can have to go and get a walker. So usually they first start using a cane, but then they can end up getting into having to use a walker, and that can throw the sense of balance off. And so then they become they develop a higher risk for falling. And then, one of the number one causes of death in people who are over 65 years of age is injuries from a fall. And so that's why falling is a big deal. And so that's why when we turn back the clock and dial it back a little bit, understanding that when people start leaning forward to get relief from that pain, it can turn into stuff that's way more serious down the line. And that's why it's time to take action when you first start seeing this happen versus down the road hoping that it goes away on its own or that it gets better on its own, or then becoming reliant or dependent upon a walker.